Vaccines are one of the most visible successes in medical science. Vaccines have proved their ability to prevent illness, disability, and death from vaccine-preventable diseases. Vaccines today provide protection from even certain types of cancer in a time when much of the media's focus is on the ongoing COVID-19 pandemic and the differences in vaccination rates between various regions, countries, and socioeconomic groups. Improving health literacy has never been more important. In this video, we're going to discuss health literacy on vaccines. The video is going to be amazing, so make sure you stick to the end. Before starting the video, be sure to smash that like button and subscribe to never miss out on any of our videos. Health literacy, the ability to understand and act on health information, is one of the most pressing issues in healthcare today. The emerging evidence suggests that the health literacy approach can increase uptake of preventive health services, reduce health inequity, and improve health outcomes. Linking with the current COVID-19 crisis, the health literacy approach can play a crucial role in increasing uptake of preventive measures to curb the growing health, social, and economic burden of COVID-19. Majorly, it can help increase the uptake of COVID-19 vaccination by fighting the infodemic and overcoming vaccine hesitancy among the general population, and can help achieve herd immunity at a faster pace. In a 2020 survey conducted in a nationally representative sample of 3,133 adults in the USA, 20% of respondents intended to decline a vaccine once available. The most important determinants of COVID-19 vaccine hesitancy were distrust of vaccine safety and general vaccine avoidance, as implied by not having had a flu shot in the last 2 years. Further, the authors noted that inconsistent risk messages from public health experts and elected officials may reduce vaccine uptake. Likewise, a survey conducted in Portugal in late 2020 identified having no intention of taking the flu vaccine and perception of the information provided as inconsistent and contradictory as two key factors associated with COVID-19 vaccine hesitance. This indicates that clear, easy-to-understand, and consistent messaging is key to improving health literacy and fighting misinformation. In addition to vaccine hesitancy, Vergara et al. 2021 highlighted that two even bigger challenges that public health authorities will be facing in the new normal are the postmodern condition of information blast and the objectivity of the health truth. We're looking at a brand new type of epidemic, an infodemic, where fake news and false scientific claims are progressively spread. A new vaccine literacy advocacy could be built on the idea of health literacy, defined as the degree to which people have the capacity to obtain, process, and understand basic health information and services to make appropriate health decisions. In a 2009 ministerial declaration, the United Nations proclaimed health literacy as an important factor in ensuring significant health outcomes, calling for the development of appropriate action plans to promote health literacy. 2 decades of research have documented that limited health literacy affects people of all ages, races, incomes, and education levels globally. Limited health literacy is also linked to worse health outcomes and higher costs. In the U.S., the Institute of Medicine Roundtable on Health Literacy has helped elevate health literacy dialogue. Chinese Health Minister Chen Zhu has stated promoting health literacy is a fundamental cost-effective strategy. U.S. HHS Secretary Sebelius also indicates health literacy is needed to make health reform a success in the USA. Finally, recent legislation has been introduced in the U.S. Senate, S-174, to advance health literacy in vulnerable populations. However, evidence, proclamations, and policies aren't enough to promote immunizations. What's needed is sophisticated advocacy and communication from personal to wireless to advance vaccine literacy. When a person's or community's health literacy is poor, misinformation can quickly spread. Again, vaccine hesitancy is probably the most obvious example here. What started with Andrew Wakefield's now retracted fraudulent 1998 paper showing a supposed link between the MMR vaccine and autism has turned into a worldwide phenomenon of mistrust against the medical scientific communities. Unlike for other conditions where the only affected person is the patient themselves, plus their family and loved ones, vaccine hesitancy can jeopardize public health by hindering herd immunity. In this day and age where many seek health information from Facebook groups, it's easy for echo chambers, communities of like-minded people, to form. Such echo chambers allow misinformation to spread like wildfire, and no one questions the sources of information. While it's tempting to dismiss the vaccine-hesitant individuals as foolish or poorly educated, it's important to be compassionate and not to blame them for not understanding information that hasn't been made clear. Research has shown that it's increasingly difficult for people to separate evidence-based information from fake news and clickbait. Everyone is at risk for misunderstanding complex health information, especially if the topic is emotionally charged, as in the case of vaccines. Health literacy is also important on an individual level, as it can help patients and caregivers to advocate for the best possible care, and is directly associated with medication adherence, healthcare usage, and overall health outcomes. Living now with a pandemic by a known coronavirus pathogen, questions abound: will the vaccine work? Is it safe? How do I get it? When will I or we be protected so that we're back to normal? Are there enough doses? Do I need 1 or 2 shots? Do I need to get a test first to see if I've been exposed or have antibodies? Was this vaccine developed too quickly? Does the new mRNA vaccine create new risks for me? Should I take this vaccine or wait for the next one? Why do I still need to wear a mask and social distance after getting vaccinated? Many are proud of the science, resources, technological advances, and coordination that facilitated the development of these vaccines. Now, with production and distribution ready to reach people globally, an investment in communication is urgently needed to answer the public's questions and to ensure everyone understands what they need to know and do for vaccination that holds promise for a return to normal life. This is where vaccine literacy, initially presented in 2011 as part of the Harvard Advanced Leadership Initiative to innovate healthcare in America, can play an important role. Scientists and regulators have developed and approved vaccines that are proven to be safe and effective, but strategic plans are underdeveloped for ensuring an informed and engaged public can successfully vaccinate to reach the level required for community protection. Increasing this special form of literacy includes arming each individual with the skills, ability, and knowledge to choose to accept vaccination. This will require getting public health, healthcare, business, and education systems to provide equitable, universal access and generate demand for vaccine uptake, as well as investing in digital health and communication improvements to monitor progress and coverage while making COVID-19 vaccination a social norm globally. The infodemic is excessive information, including false and misleading in physical and digital environments. During a disease outbreak, the looming COVID-19 crisis has heightened the need to create awareness about the importance of addressing the health literacy of individuals, communities, health organizations, and health systems. The COVID-19 crisis exposed the existing health inequity, overwhelmed the public health system, and revealed a parallel threat: the global infodemic. Infodemic has infiltrated the current media and communications environment with excess, misleading, and harmful information, resulting in the lengthening of the COVID-19 pandemic. Infodemic is affecting people's ability to access the correct information at the right time. Understanding health literacy, strengths, and challenges will help co-design context-specific, culturally relevant, and locally responsive solutions to support individuals and communities in making healthy lifestyle choices to protect them and their families from the growing burden of the COVID-19 pandemic. It's clear that COVID-19 has put health and scientific literacy in the spotlight. Just like the acceleration of telehealth and digital transformation, the impact of this will be felt long after the pandemic has ended. To fight the infodemic and ultimately improve patient outcomes, pharmaceutical, healthcare, and public health leaders need to proactively work to improve health literacy in all populations. It's a huge task and one that can't be accomplished by a rapid vaccine rollout like the other pandemic. Nonetheless, it's a battle that needs to be fought if we want to empower patients to make the best possible health choices. Let us know your opinion in the comment section below. This was all for today. Hope you liked the video. Don't forget to subscribe to our YouTube channel. Stay safe, and we'll be back soon with another video.